opponent started off his argument stating that we should provide adequate health care instead of providing physician-assisted suicide. The only issue with this is that adequate health care will result in using painkillers as an alternative, but studies or painkillers are an unavailable and unreliable alternative to physician-assisted suicide because, according to Judy Lentz, the CEO of Hospice and Palliative Nurses Association, a survey of about 1,900 hospice nurses found more than half identified tremendous problems in access to pain medicines. These are people in the last hours of life. Lentz says one person with cancer had an unpleasant death due to unrelieved pain. And also, another story was recorded in Australia, which was titled "Poised to Win the Right to Die" by Sarah Martin. She said that painkillers are not always a viable solution. Jim Wilson's late wife, Wynne, suffered from multiple myeloma and could not take morphine to ease her pain. She weighed only 33 kilograms. She was skin and bones, and her bones were falling apart. She was excruciatingly uncomfortable. So this shows that painkillers are not a solution or not an alternative to physician-assisted suicide through the healthcare program. The opponent also cited that the Hippocratic Oath should be used by physicians, but the Hippocratic Oath is based under the assumption of a different understanding of medicine and does not relate to modern diagnostic procedures. For example, Hippocrates, who formed the Hippocratic Oath, believed that the diseases were a result of foreign imbalances: blood, flash bile, yellow bile, and phlegm. Because he had different and incorrect understanding of the human body, it is not comparable to relate his ideas and philosophies to modern-day medicine. And then he continues saying that mental illness, a lot of the people who are taking physician-assisted suicide, they have mental illness which impairs their judgment, but there are certain rules and regulations that allow certain screenings and tests to be done before a patient is admitted to be euthanized. And Oregon's euthanasia law sets strict regulation regarding which individuals are screened through mental and regarding their mental and physical health before being approved for physician-assisted suicide. And Oregon and Washington specifically define what terminal illness means and what qualifications one should meet before being considered a terminally ill patient. These patients also make informed decisions. In Oregon's assisted suicide deaths in 2009, more than 70% of the physician-assisted suicide had college. They attended some college or they had a bachelor's, showing that these individuals are well educated and are able to make an informed decision based on the amount of suffering and likelihood of death. Also, these people talk to more than just their physician. They also have input from their physician, nurses, and families. According to Belgian physician-assisted suicide, based on the Canadian Medical Association Journal, 77.4% of those euthanized discussed their choices with their family, and 89.1% discussed their decision with other caregivers as well, such as physicians, nurses, and caregivers specialized in palliative care. And some other reasons that they chose physician-assisted suicide include 59.9% who experienced severe pain, which proves it is one of the major causes to choose physician-assisted suicide. And also 96.1% of those individuals who were screened, or 9.6% of the individuals had less than 1 month of remaining in their treatment. 10.2% had 1 to 6 months of treatment, and 80.3%, the large majority, had more than 6 months of treatment, which shows that they had enough time to consider the consequences and the positions that they were in. And the treatment stages include 1.2%, they were still trying to seek a cure to their illness. 4.6% were deemed to have trying to get their life prolonged, but 94.3% were only trying to become comfortable in their situation. And the reason they chose physician-assisted suicide was that 84.4% of the 142 people screened had no prospect for improvement, so they either stay sick or they die early. The opponent also said that it's a slippery slope. Well, it's not a slippery slope because Oregon has had this law active since 1997, and it's been 13 years since then, and that has not resulted in any mercy killings. For example, a 2007 report by the International Task Force cited that there were no patients with dementia or depression killed. This 10-year time span proves that mercy killings will not occur as a result of physician-assisted suicide. And also, there is a study done by the Sydney Morning Herald, reported by Julie Robotime, that the legalization of euthanasia does not increase the rate of physician-assisted suicide, according to Belgian oncologist Jan Bernheim in his October 2010-based study on evaluating physician-assisted suicide between 1998 and 2007. He said that legalizing voluntary euthanasia has little effect on the number of terminally ill patients whose lives are ended by a doctor, but it does reduce the number of proportional of cases that occur with the person's explicit request. And this shows that the illegal physician-assisted suicides that occur decrease because of the legalization of physician-assisted suicide.